Well, hello. Good afternoon on this Tuesday that is a delightful temperature, hopefully giving some relief to some people all over the state. And this meeting will be recorded and posted to the website for any of you who are not on the call or have to go for some reason. So if you don't know me, my name is Melanie Riddle, pronouns she, her, they, and I am the Grandson Finance Coordinator for OEMS. And we're here today to go over the grant applicant information session for the Rural Ambulance Service Treatment in Place pilot. So today we're going to be going over the RFP, the application, answer any additional questions if you have them. Let me get this. I've got it sharing. There we go. So number one, let's talk about the treatment in place, the whole overall goal of this RFP. We have the definition as refers to a clinically meaningful assessment and/or intervention performed by licensed EMS personnel in response to a 911 call in accordance with the agency's medical director approved protocols that results in a documented medical decision not to transfer the patient by ambulance. So that's going to be our central guidance piece within this RFP and this grant. Kind of an overview, we have just over 9.2 million available to grant out, and we estimate the grant period to start October 1st. That depends on if we actually get a fully executed contract by October 1st, but again, we're aiming for October 1st through August 31st of 2027. And the overall of that 9.2 million, each TIP response call that meets the definition of treatment in place is eligible for a $500 reimbursement for that call. So looking at the overall timeline, we issued the RFP July 6th. The applicant information session, y'all are in today or you're reviewing after the fact. And then written questions, you still have some additional time if things come up after this recording. July 29th at 4 p.m. is when we have the final application questions due to us, and we will do our best within 7 days to get those responses posted to the website. Applications are due August 17th at 4 p.m. And then we anticipate in September to have some award notifications, again, reaching out to go over the contract requirements, have the contract signed and fully executed. Again, that's when you all as the potential grantee would sign the contract as well as our director signs the contract. And then in October, that grant period starts running through August of 2027. So eligibility criteria, there's only one, and it basically means that you primarily provide service outside of the 7-county metro. So that would be Anoka, Carver, Dakota, Hennepin, Ramsey, Scott, or Washington. The overall purpose of the grant, increase healthcare access within rural Minnesota, establish the treatment in place ambulance service protocols, improve health outcomes for rural Minnesotans, reduce ambulance transports to the emergency department, reduce repeat 911 calls, and provide reimbursement for ambulance services providing treatment under the TIP protocols. The application is broken out into 6 sections. So we're starting with the ambulance service information. This is going to include names of whoever needs to be contacted, name of the authorized person to sign the contract, phone numbers, emails, all of that. Your overall project description, service capacity, that's some questions that we'll go over, and then treatment in place protocol is kind of an overview of what you're planning on doing. Then we have the treatment in place budget and work plan, and then the required exhibits, which we will go over. So again, There's a couple different requirements depending on how much your grant is going to end up being. All applications are required to have the TIP project overview and budget. So that's your online application that I believe Haley just linked. And then Exhibit A would be your medical director letter of support. We have provided an example for you to use. It does not have to match that exactly if you have something else, but we thought that that would be helpful because this is overall, we're looking for a signed letter of support from your medical director, and that does need to be a wet signature or a PDF, a verified e-signature. So like the PDF e-sign or DocuSign as an example. And then the Exhibit B, the Rural Ambulance Tip Work Plan, which we will also go over, that is a requirement for all applications. If your application and your grant would be $50,000 or more, you need to have additional attachments and exhibits to submit with your application. And these are just the requirements based on state statute for grants 50,000 or more. So depending on if you're a nonprofit or a for-profit, that's going to change a little bit whether you use G or F for the exhibits. And then everybody else would need to do C, D, E, and H. Up this part. So you should be familiar with this. This is the overall website of where you're going to access the application and access the attachments. It's also where we post the question and answers. So we have had some questions. We did post this July 13th with the responses, and we will have another one following this presentation as well. We have a couple other questions that came in, and making sure if there's anything today, we will make sure that they are posted this week. So scrolling down, we have all the key dates that I've listed. We kind of tried to pull out some of the highlights of what we're going over today, but it is here for your review as well. And then down here in the application content is where you're going to find those exhibits to download, to complete, and then be able to add to your application. So again, here's another, I'll click on it. Here's another link. You can access the application, and then all of these attachments are going to download for you to be able to complete them. The one I just opened. All right, so this one, this is what you should see. You're going to click start. This is one that I've already gone through so we can see each page because otherwise you have to complete everything before to be able to see it. So this first submission checklist, this is just for you. You're welcome to check it of things that you're including. It is not a requirement. It's just to remind you of what you need to complete this application. And any issues, please reach out to us with the form. So this is that section 1, so the ambulance service information, making sure that you select the ambulance type because that's also could impact what potential attachments you need to include. And then which counties will be served within your PSA by this grant, making sure you click that one. The other one that I want to let everybody make sure that they have on hand and just figure out who within your organization has the SWIFT vendor ID. That's a 10-digit number, usually starts with 3 or 4 zeros. And if you don't have any idea where that is, Haley just posted a link in the chat of basically the MMB, the Minnesota Management and Budget. They manage it. So coming to this page, you can reach out to them. They have probably email's the best, but they do have a phone number as well of trying to figure out what your vendor number is. There are some ambulance services, if you are a municipality, it might be the city or the county that's the SWIFT vendor number that you would use. One important note that especially our finance department has been focusing on is making sure that whatever your ambulance service address is, making sure that that is listed as a location associated with the vendor number. That's become an issue that could hold up payment down the road if you are awarded the grant. So just making sure those pieces that you have that number clear. I've seen some that come in that somehow are the right digits but aren't the right number. So just making sure that it is a SWIFT vendor ID, and that helps make sure that we link the contract to the appropriate vendor, i.e. you, who should be paid for the grant. Like I said, making sure all of this information is correct. We put this into the contract, and we do have to email. We send out our contracts via DocuSign, so making sure we have the correct email address for anybody who would be signing the contract, as well as who we should reach out to. I saw a quick question. If there are multiple licenses, yes, this is a application and grant that is tied directly to each ambulance service. So they would each need an application as an individual entity, even if they are operated with one. All right, we get into the next section, section 2, the project description. Again, this is all listed within the RFP, but it's just a reminder, those are those purpose and the goals. Looking at the project overview, so all of these, this total possible application points for this one is going to be 25. There are 5 questions, so 5 points for each question. I do not need a gigantic book, but there is no limit to the response. That way it allows you to put in the information that you think is important for us to know, or any of the grant reviewers to know as well. And then we've got our next section, which is section 3, the service capacity. Same thing, this one is 20 points, 5 points per question. Looking for an overview of kind of how are things going. We know the trends and we know what we should be expecting to see, but we're looking to see that reflected in the application as well. And then this section 4, it's one single answer, but making sure you hit on each of those points that need to be addressed by this question. So describing the treatment in place protocols that will be developed and implemented. So again, this is not necessarily something that we are wanting a final protocol, but we want to understand how you are going to develop those protocols. And that point, that section is worth 25 points. Then we have the budget, the work plan and budget section. And this one, the budget piece is very simple. It is simply based off of the number of projected ambulance service calls that you anticipate following treatment in place protocols. So this one, I've just inputted 250 calls, would come out to a $125,000 grant. And then you are going to upload your Exhibit B tip work plan template. And I will go to that. So this again is what you're going to download off of the website. There are work plan definitions in here, just if that helps you answer any of the questions. But the important pieces that I want everybody to recognize is we have 3 required components of the work plan. You, as the ambulance service, can come up with additional goals or objectives if you would like, but it is not required. So we need to see these 3, the TIP protocol development, again, how you're coming up with the treatment in place protocols, the training plan, how you're planning on training all your employees to do the treatment in place protocols, and then the project rollout. When do you anticipate the planned completion date for these items of the completion of the TIP protocols, the training, and then implementation of those during calls? So that is that attachment. That's where you're going to put it right here. One thing I also want to highlight here, this piece, if for some reason you're not seeing the exhibits, you're planning on having a $100,000 grant and you go to the next page, I'll show you what happens. So I just forgot the 0, right? It reduced my grant request. I'm going to hit next. It looks like I only have to do Exhibit A, Medical Director Letter of Support. That is not correct if you're wanting your request to be 100,000. So making sure that if for some reason you know you have to add the exhibits because your grant is going to be over 50,000, making sure this number, that's going to impact what that next page shows. Because now I've got all the other responses, the exhibits that I have to attach for this one as a governmental entity. So just want to highlight that. That will kind of change, as you all know, because most of our stuff is through Form 2nd and Telestack. That's what you should see. And then from there, you're just going to submit the grant application, or you can also choose to do the save and resume later. It will email you a link. You will put in your email address, and it will have saved to date what you submitted at this time, not submit, sorry, what you saved at the time that you said save and resume later. So if you go in and work on it again, you would want to do an additional link because it won't save on the same link, I don't think. So I would just do it again. And that way you kind of know stuff is in there just in case. We still recommend working on Word or email or whatever you want to do to figure out some of the questions just in case, because but I wanted to also show you all, so I've done everything, everything's attached, I've put entries, they are not relevant, but I've put entries into everything. And then you submit the grant application. And you need to be looking for this screen. Thank you. Your application has been received on this date. You will also receive an email with this information as well as the information that you submitted in all of those, answering all of those questions. If you do not see this screen or you do not see the email, that means we have not received your application. So reach out to us in case there's some error and or because we're not going to be on at 3:50 on August 17th, making sure trying to do this at least a day in advance in case there's any issues. But I wanted you to know that that's how it should come through. So let me go back to this. And I think some of the other questions I will answer at the end, or we can review them at the end. Going back to this. So again, reminder, applications due August 17th, 4 p.m. Looking at the review process, so this is a competitive grant review. So we're first going to start with an overall screening. So basically myself and Haley Myers, who's been posting the link. She's actually the grant specialist for the Treatment in Place project. So thank you, Haley. And we will be reviewing the eligibility and whether your applications are complete. From there, then the applications that are complete and are eligible are going to go on to the scoring, which is by our community reviewers as well as some staff. And we're looking for reviewers as well now. If anybody is not applying and would like to be a reviewer, you can do that. And then after all of that, everything is scored. We also do the risk assessment, and this is based off of the state statute and the Office of Grants Management. They've set certain policies around making sure that we do a pre-award risk assessment. That's why you have all of those attachments, and reviewing just overall if you've had prior grant experience with the state, whether us or somebody else. So we take all of those into consideration. And then the final decisions are at the discretion of the OAMS director, so Dylan Ferguson. We try and get this all done as quick as we can. Again, the scoring total possible points are 100. We talked about the breakdowns, the treatment in place protocols, that's that question section is 25 points, the project overview, 25 points, service capacity, 20 points, and then the work plan and budget, mainly the work plan, but the budget is of course ties to that, but it's one line. So I know you all will be able to do that one, is 30 points. And then to kind of give you an idea of what it looks like after you would be potentially awarded a grant. I say this a few times, monthly reporting and invoicing. We're going to make that as simple as possible, but especially because this is federal dollars that we're a subgrantee of from MDH, and then all of the funds came from the US government. We are needing to follow the monthly reporting and invoicing so that we stay on top of everything. And then any funds received are limited to costs associated with providing TIP. So as with other things, this money's coming in, you cannot bill. Say you had a TIP protocol call and it ended up costing you 700, you cannot bill any other service or have any other thing, whether it's the individual that received those services or to insurance, you cannot bill for that. So that would only be from the TIP response reimbursement amount. And so that's why the funds would go to supporting that call and costs associated with it. And overall, we're looking for compliance with Minnesota statute and policies. We walk you through all of that. That's very clear. We're working on a website to kind of help everybody understand what those requirements, and they are also listed within your grant contract. So reimbursement will be monthly, again, based off that invoice and progress report that we would receive. We're working on it, but basically a spreadsheet for you to fill out as well as submitting everything through FormStack. So again, trying to keep it simple so that everybody can get paid in a timely manner, as well as we're managing the requirements of the grant. And then the important piece for this is we need the patient care reports for the ambulance responses. We will be reviewing those, and essentially will be looking for the patient care report number and to ensure they meet the eligibility, the call meets the eligibility for reimbursement. And then qualification goes back to that treatment in place definition. It must result in a documented medical decision not to transport the patient by ambulance. Your responsibilities, funds must be used for TIP ambulance response. You must maintain your financial records. This is true for all of the grants from us. And then monthly invoicing and reporting. Again, I say that because I know monthly can be challenging, but it is something that we're going to need. So that's the end of my overall presentation of the application, the RFP. I know there's been some questions in the chat. And then just a reminder, send any other questions and then where they're going to be posted. And I'll leave that one up and then let me open up the chat. Got to scroll up. All right, so what warrants a higher versus lower score? Is something more innovative scored differently, or is it based on how complete the answers are? So our reviewers are essentially looking at, in fact, if I can go and get it. Give me a second, I will pull it up. So all of our reviewers receive a handbook and has a rubric for what basically you're looking at, like, is it a poor response or a good response? Each reviewer can have kind of a, I mean, innovation is not going to be, we don't have a guide in terms of like content. It's like, how well did they answer the question? If that helps. All right, thanks for bearing with me. So this gives you an idea. It's not specific to the TIP grant, but just an idea. So each reviewer will get a handbook. It goes over, they have to look at the RFP, look at the questions, and then they're going to be reading the proposals, rating the proposals at the bottom of this. This rating scale key is not to this one with the 5, but just gives you an idea of like, we're looking from the poor to the excellent in terms of like a full response to the question. And then is reimbursement contingent on a full ambulance response, or can a single resource response like a supervising unit or community paramedic first responding to a 911 suffice? I'm going to have to defer to Charlie on that one and get back to you on that. So stay tuned for that answer. There, in terms of just sign AMA, or will they be adding the tips option into image trend? I know that we're working on what image trend is going to be looking for, so we will have guidance on that. I don't have that answer right now. And will there be a continuation of reimbursement for TIP following this grant? At this time, we don't know. We know the Rural Health Transformation Program, I believe, should be a 5-year, but at this point, we have an interagency agreement for this 1 year, and we have this grant for this 1 year. So at this point, I don't have any additional guidance on that. I would hope, but I don't have an answer on that one. If our ambulance services are on the same tax ID, do we still need to submit one application per location? I think you've asked this question before. Somebody has. Um, it depends on your license. So I care more about the ambulance service license. So let's go off of that. And regarding patient care report, will the state provide that? No, that's what you submit in Image Trend. So that's what I have. I figured we would be pretty quick because it's just going through things. Any other questions? All right. Well, I appreciate everybody's time. There's the one that's coming in. Specific protocols, guidelines regarding decisions to not transport or concurrent guidelines be used with augmentation to the no transport. I'm going to wait to answer that one because we have had a previous answer that might be similar to that. I believe we have provided an answer that kind of gives what you should be thinking about. I do not think that there is exactly specific because we know that this again is a pilot project, and so we're trying to understand of like and also allow each medical director and ambulance service to determine that. If there's a new hardware that could be used, will it need to be FDA approved? I don't think I have the knowledge to answer that question. I don't, well, I'll wait on that one. I don't think I know that one. And is there a way to duplicate the application and just change the license number and run details? We have 6 licenses. That's up to you. That's up to you. Submitting an application. I know it's challenging with the duplication, but we really need this to be each ambulance service, each license. So however you want to submit the applications, that's up to you. Do all responses made under the TIP program have to be billed to the TIP program? If a no transport TIP call is going to be paid better by traditional insurance, what is the incentive for services to implement this program at a rate that is likely lower than what might be paid otherwise? I'm not clear on what the goal of the program is. Shifting already inadequate reimbursement from the current payers to a different payer is not necessarily solving the issue of rural EMS sustainability. So it is not a requirement that you use the grant for an eligible service call. If you decide that you do not want to submit a TIP eligible response for reimbursement, you do not need to do that. The rest of it, I don't think I can answer, but it is up to you as the grantee. It's not a requirement that every single call that meets eligibility be submitted. The important thing is that you are following your work plan and your budget. That would be the important pieces that we're looking for, and that you're not, if there's one that you submit, you may not bill anybody else. So if you decide you want to do it a different way, then don't submit that one for reimbursement and we won't have an issue. Please define medical response. I will do that in the written words because that's not mine to answer as the grants person. But we will list those out. Any others? Beth, if you submit to car insurance and they decline it, could you add it to the treatment in place afterwards? I'm going to get back. I want to think about that answer. This is great. It's also helpful to have everybody's questions so we can make sure that we can answer them and make sure that everybody has the same program. So if there's any other questions that come up, feel free to email us and we will, like we said, respond and by posting them to the website where we have, it's the one document and it'll say when it's updated and you'll scroll down and the most recent answers will be, questions and answers will be posted on the same document. So look for the date that it was updated to see when additional information has been added. But other than that, I appreciate everybody's time and looking forward to hopefully some applications from everyone. And just one final thing of reminder, this is a pilot program, and so we are also just looking for how this goes in general. So this is the initial RFP that has been issued for this grant funds, and let's see what happens. So, all right, well, everybody have a good day, and we'll post this to the website. Take care.